Technology is everywhere, and many older people are using it, but is it being leveraged to its fullest potential? In this episode of Aging Unscripted, we're talking about how to shift from fear to confidence and using technology for connection, independence, and improving quality of life. Welcome to Aging Unscripted, a fresh take on what it means to age. Here we challenge assumptions, spark new thinking, and explore how aging can be lived with purpose and possibility. I'm Jill Vitale-Yassam, and I am privileged to serve as the president and CEO of Christian Living Communities, a nonprofit senior living and services organization based in Denver, Colorado. And in studio with me today is our co-host, Pam Sullivan, and Pam is our vice president of communications and philanthropy. Welcome, Pam.
Thank you.
And joining us remotely today is Matt Reiners, and Matt is the Chief Growth Officer at Parasol Alliance, a senior living technology solutions partner company. And Matt is the host of Connecting the Dots, a senior living success podcast. Welcome, Matt.
Happy to be here, Jill and Pam. Thanks so much for inviting me on.
Absolutely. We're thrilled to have you here. So today we're, talking about something very interesting at, I think, a really fascinating time. I remember years ago at Claremont Park when we launched tablets for the first time. It was like 2013, maybe.
Yeah.
And I remember it was a huge opportunity and a huge challenge. And one of the big challenges we had is residents don't know how to tap on a screen, right? And so now you think about, oh my gosh, how far we have come,
right,
in such a relatively short period of time. And AARP did a study in 2025 that said folks over the age of 50 are embracing technology at higher rates than we've ever seen before, which makes a lot of sense, right? 90% own smartphones, nearly 3/4 use social media, and almost half of adults over 80 say technology helps to support healthy aging and independence. And then at the same time, there's some feedback that older people feel technology maybe wasn't designed with them in mind. And there are, of course, concerns of people at all ages about the complexity, about scams, right? Affordability. And now artificial intelligence adds a whole different layer. So today, we're thrilled to have Matt here with us to explore both sides of that reality, the opportunities of technology and the barriers that still exist. So Matt, thank you again for being with us. Can you share a little bit about you and how you got where you are today?
Yeah, of course. Thanks, Jill. And I'll try to make this 15 years out of like 30 seconds here for you. So background is I've helped build and sell 2 technology startups. One was hyper-focused on helping older adults to hear better. I saw what my grandmother couldn't do. She couldn't hear, so she would never go to group programming or really do anything and just isolate herself to her room. So that really set us on a mission to try and create technology. And it's where I first saw how like technology can really improve that quality of life for older adults. And just, I've been on this path ever since to really just try to change the vibe of what technology looks like as we get older in senior living communities and all of that. It has led me to Parasol Alliance now today, where we believe tech is a vibe and we think that it's really the future. The data supports that, and we're just trying to help people where they are to make sure that they're set up for success, whether they're staff or at the resident level or even the family level.
So do you think that older adults are vibing with you? Do you think they see the value that you're seeing in technology at the moment?
Yeah, it's a good question. I think it really depends on who you ask. I hate to have the answer. It's a case-by-case basis, right? But I go into some communities that, I think the residents are more tech enabled than some of the staff members. But then I've gone to some situations where they don't even want to touch a piece of technology or get a smartphone. I think back to my grandmother where she embraced, when we introduced audiobooks to her, probably like the simplest tech when you kind of think about it, it really just reopened her entire world because she had lost some of her sight. So, it really depends. I've sat on panels. I've gone to communities where, electrical engineers have given me feedback. Then I've gotten others where they don't even want to have a smartphone and they just got the flip phone. So it really depends on kind of the market and the individual that you're helping.
And that's not always age related, right? I mean, there are just certain people that like technology more than other people and who are more comfortable.
Yeah, I think it's a good call out, Jill. I don't think it's necessarily an age thing. I mean, the data supports that. Like, even in some of the older adults, they've got more technology than some of the younger generations.
Yes.
So yeah, and it's
Yeah.
funny, like even people around my age, I've seen people that are definitely tech forward, tech enabled, want to do that. And then I saw other people that don't want anything to do with it. So to your point, it's really the individual. And I don't think necessarily it can be, the age is not the main differentiator.
And there's a real difference between using technology and leveraging technology. Going back to what you were saying about your grandmother, and that's leveraging technology to improve your life. It's not just consuming Facebook or whatever. Are you seeing people starting to kind of get to that point where they can actually leverage technology instead of just being consumers of it and use it as the tool it can be to improve the quality of their life?
Yeah, so I think it's a good thing to call out because there's still some people like my mom who love to just doom scroll on Facebook. I think that's the extent that she's using it. I hope she doesn't listen to this. Love you, mom. But then to your point about those that are using it to just be more proactive with their overall health, right? Like there's simple things that you can get. Like, let's think of like an Apple Watch as a good example, right? Some people might just get it to tell time, check messages, but you can really start leveraging it in a whole new way where you can use it for health monitoring, tracking heart rate, detecting irregular heart rhythms, monitoring sleep, right? Like I've got all these things that's able to funnel data and look for when I'm going off of those patterns. So I think there is this push, especially for older adults, to start incorporating some of this stuff into their life. Because even with the Apple Watch, right, it has fall detection, all this other stuff. I've seen with the AirPods, it now can do like what hearing aids are now doing. So I think it really depends on the individual and what problem that they're trying to solve and seeing if technology is there. I think, we all kind of grown accustomed to how we handle problems on a day to day, but technology is one of those things, if built right, can really help that individual to leverage it rather than just consume it.
Absolutely. When I'm out, so with artificial intelligence, right, that's a whole different, a whole new opportunity. And when I've been out at our communities, everybody's got their phones. A lot of people, we're actually doing a pilot at our Holly Creek community with an entity called Moira Club, and they use the Aura rings as part of their, there's a lot of coaching and, supporting people to live a long and healthy life. So, there's people with all these devices, but then I'll say, now who has tried like ChatGPT or other things like that? And a lot of people are like, I have not tried that and I'm concerned about it. At least this is what I'm hearing. But I don't know if people always understand, like you're using AI when you're using Waze, right? Or to get where you're going, and there's AI baked into everything. I'm curious what you're seeing with older people in the use of artificial intelligence as kind of a standalone, right? In a like ChatGPT or something like that.
Yeah, I'm glad you called it out because it like really took 80 years for AI to become an overnight sensation. Because like to your point, right? Like it's been around since like the 1940s in terms of like the Turing test and some of these other things that were out there. If you've been using Waze or Google Maps, like that's AI that we've all been using for over a decade now. But to your point about really at the forefront, I think a lot of people are nervous to use it because of the data concerns and all that sort of stuff, which is understandable. I mean, I'll tell you, even before AI, my data was getting leaked all the time to everybody, and people are trying to open up stuff in my name. But I think with AI, like it depends on how they're thinking about using it, right? I find people that might be a little bit hesitant to use AI, ChatGPT, Claude, like all these LLMs, right? Like I always try to coach them, like would you use it in your personal life, right? And I always use the example of, so my wife and I, we've got 2 little kids. Cooking can get tough at times. So ask ChatGPT to like give us some different recipes that it's like protein heavy, takes less than 30 minutes to make, a healthy side. We'll then get all the recipes. We'll get like 5 recipes. We'll pick 3 from there. And then of the 3, will say, please create the shopping list associated with these. So it does like all this stuff to really help with that. And I always try to coach people like AI, ChatGPT, all these things. I'm really embracing this mentality of automating the mundane to elevate the meaningful. To each person, the mundane means something.
Go back and say that again.
Yeah, automate the mundane to elevate the meaningful.
I like that a lot.
Because each person has to deal with mundane stuff, right? We all have to deal with it. Mundane might look different for each person, and then meaningful looks different for every person, right? So how can you use AI? Like it's just a tool in the tool belt, right? But I have heard stories of residents using ChatGPT. There was a community that had some Japanese scrolls in their lobby. No one knew what it said. So they took a picture, put it in the ChatGPT, and it was able to get the translation. like
Amazing.
that.
That's
So-
Pretty cool.
Amazing.
Yeah.
I've done that recipe thing in reverse where I'm like, I have 5 things in my fridge right now. What can I make
Right.
with that? You know, so it's a very helpful tool. But I wasn't an early adopter. I'm kind of more middle of the road.
Yeah.
What are some of those easy steps that you would recommend for family members trying to encourage their loved one or an older adult to try and say, hey, it's a little nervous. It's a little, you've heard the bad things, but let's be going forward in good faith and to take that first step to kind of go beyond using to actually leveraging.
Yeah, I think it's all about how it's introduced and talked about, right? Like I find like introducing it as an assistant and not something like mysterious or threatening or something that's not going to take over the world, which I knock on wood every time I say that. And to your point, like even just really helping to craft the narrative that you're probably already using it in some capacity, right? Like Jill had said about the ways, there's definitely things that people are already using for it. And then I find the best approach is just some of those practical examples, right? Depending on the individual and what they're doing, whether it's, maybe someone's trying to write an email, someone's trying to organize information, right? Like my mom's obsessed with quilting. So I could basically say, hey, take a picture of all the like random pieces of quilting you have, upload it into that and get some ideas of like what it could potentially look like, right? So I think it's all dependent on the individual, what they care about and how could it make life easier / better for them.
And I think it's really knowing the person you're trying to support,
Yes.
right?
Yes.
Because I think you're absolutely right. How many times have we heard, got my mom the new tablet and she's using it just to look at pictures? And that's a fine use, but there's more that you can do. But it's helping set them up with what is the use case? What is the assistance that it can bring? And then helping them through how do you do it? That's part of it.
And that's the answer to everything in elder care. Really is knowing people, being well known, and adapting everything to the individual. So that's a really awesome point. Thank you. Hey, Matt, I'm curious. So we talked a little bit about individuals, right? And I mean, the uses for AI are really endless. How are you seeing artificial intelligence helping senior living providers and care partners? Like what is happening now and what do you think is coming?
Yeah, so I think where we're seeing AI being most used for some of these senior living communities or the care partners is helping to reduce some of the administrative burden. So really caregivers can spend more time being human and less time doing paperwork, right? Like I always go back to that saying that we said before, right? Automate the mundane to elevate the meaningful. So we're starting to see more and more communities using it for that. We're also seeing it has a huge potential for predictive support, right? Like where I see a lot of money being invested, funneled through is some of these ambient monitoring systems, right? So just allow people to be more proactive with their care, right? And to see if certain situations are taking place. Because where I think there's a big opportunity, right? We're talking about some of the staffing crisis, which I know is not a surprise to anybody that we're talking to. I think AI will allow us just to be more intentional of where we're spending our time, and it will allow us to be smarter and see when people are going off patterns, because when they're going off patterns, and that's when we start to see some of these negative things starting to take place. So I think it really just levels us all up. I will say, I think in getting AI to do what you need we're still at like the worst AI we're ever going to see is today, right? Like it's only going to get better over time. So there's a lot of opportunity for doing that. And I would say too, like, I think the biggest fear for our industry is, the humanoid robot that's taking care of everybody. But I see it more as like in the background, like being invisible, helping to cut out some of that administrative burden so we can really focus on the relationships and the one-on-one care that these people so well deserve.
Yeah, that makes a lot of sense. And, I was thinking about that with, and I believe in some other countries, robotics are being used more, or piloting at least. But I mean, there's a case where somebody might prefer a robot to give them a bath than a person, right? Like there are some things where you could see that it would be a preference for people. But yeah, like so Matt, just an example, we're piloting a system. So when we get a referral from a hospital, where there's pages and pages and pages of information about the person that has to be gone through, and now we can use AI to speed it up, and then that impacts the person and their family and the hospital, right? Because we can more quickly say, oh yes, we can help you. And having just been with my dad, who is in the hospital waiting to leave, and fortunately come to one of our communities, like that's a gift to families and the person waiting in the hospital. Like things like wait, say it one more time. What was what you said?
Yeah.
Automate the mundane to elevate the meaningful.
Yes.
Yeah. And what you just said, Joe, like that's a
Needs to
perfect
be a bumper
example, right?
sticker, Matt.
Hey, I'm looking. Hey, I got you. I'm working on that. But to your point and like your example, right? Like you still like the 50 pages. I can probably guess the company you guys are piloting, because they've been doing awesome stuff. But that administrative burden work that we all have to deal with, right? Like the referral paper comes in, it definitely needs an eye to go over it. But when you can use technology to kind of give you a yes, maybe, no,
Yep.
it just helps that. And I use AI in various aspects of my, my working, and I'm saving like 20 hours per week on just some of the random stuff that I have to deal with all the time.
We heard a little bit of a horror story this weekend. We had our staff retreat, and we were hearing from one of our providers or one of our partners about a company that didn't have the parameters in place for how to use AI and what platforms to use it. And they had a doctor who didn't like what the hospital had, who got his own platform and put all his patient information into another platform, which didn't have the guardrails on it, right? So then you have people's personal health information out. And I think that's what scares people is you hear those one-off stories and then it puts a bad name all over it for AI. But most companies, most providers, and even the platforms, I would think, are starting to get to where they understand you have to put the guardrails in, you have to put in the safety measures so that people's health data just doesn't end up everywhere.
And it wasn't a senior living example. Let's be clear.
It was a hospital example. I know, but point in it's healthcare in general, right?
Right.
Yeah.
Yeah, I think it's a great point, right? Like those stories definitely get the spotlight put on them, but it's just a good reminder to us, right? Like what are our AI policies? What are our AI guardrails? We see a lot of shadow AI taking place where we'll go into communities and it might, Copilot might be the accepted thing that people are using. But you talk to people, more people are using ChatGPT, people are using Claude. Now you could be intentional of what they're uploading into that. Of course, you want to get rid of anything that's HIPAA, PHI, anything like that. But I just find like education's key, and shame on that doctor for going out and doing all that. I feel like
Right? That just gave me chills. I'm like, you got to be kidding.
Yeah, that's wild. That's wild.
Definitely.
Yeah. But okay, since we're on that track, I'm going to go the negative piece a little bit here. But what are the warning signs when somebody is not like if we're supporting an older adult in our community or you're a family member, what are the warning signs that the technology usage may not be appropriate or can be harmful, or maybe they're being taken advantage of and not knowing it, with one of these companion platforms or something like that? What are the warning signs that people should know?
Yeah, so I would say when technology starts replacing like real world human interaction instead of enhancing it, that's definitely a concern, right? So I think there's more and more times and situations we see that popping up. I would say too, with people, and I'll say I've been successfully scammed. I pride myself on being this tech millennial that knows everything about anything, and I've been successfully scammed. But in terms of like that older adult using technology, you definitely want to be aware of some of the situations that might be taking place. Whenever someone's trying to drive urgency in a decision or to do something, definitely making sure that that is aware. There are platforms out there, and I'll say there's a freemium model with Seraph Secure that's setting up like free technology guidance. And basically what they'll look at as someone's going on a website, was the website and domain just created? Is it asking for certain information, right? So it can alert people like that. I do think scams are only going to get better, especially with AI, because, people's writing is going to get better, all that sort of stuff. So, just being aware about what that can look like. So early warning signs, right? We don't want to take away from that human interaction. And then scams, I think it's just constantly checking in, making sure like what's going on. I've heard stories that people think that they're best friends with Hermione Granger, right? So it's like, how can we make sure that we're setting up kind of checks and balances to make sure that that's not taking place? Because there's definitely some bad people out there that will take advantage of people with that.
And even beyond the scams, right? The research with younger people, I'm sure applies to all of us throughout the lifespan, is the more we're on social media, the worse our well-being is, right? And it's the depression that can come with it and further isolation. So I think that's an important thing to keep in mind too.
Well, I like the point that Matt made, human first, tech second.
Yeah.
It's the human connection. It's the well-being of the person. And then you leverage technology to continue that journey.
Yeah.
Yeah.
Absolutely.
Yeah.
Matt, what's got you all jazzed about the future of technology and aging? Like, what do you see in the future? What do you like? Oh, I can't wait.
Yeah. I would say when I think about like the future in technology, especially like in this industry, I just think like integrations are key, right? Like everyone's coming out with these, these golden spoon technology innovation, but I do think like integrations and making sure that everything is working together is what I'm so excited about for this industry. I think when I think about the individual, is just like how can you use the technology to be proactive in your health journey, right? We were kind of talking about that earlier on, but like, it's funny, like I've got years of data now to kind of look at my own health and well-being and trying to figuring out some of that stuff. And even now looking at my genetics and all my family stuff. So I think what's really got me excited is that, this idea of really embracing that and being smarter, right? So whether it's smart home tech, wearables, proactive health tools, because we can really shift this idea of healthy aging from reactive to preventative or proactive. So that's what I'm really excited about.
I'm so excited about that integration piece. I mean, the time studies that we've looked at with the duplication of work because one platform doesn't talk to the next. Woo, that would be huge and again, getting back to the point of it, we would have more ability and time to work with people rather than trying to get this platform to talk to the next and double entry and all that good stuff. So I'm very excited about that personally.
Yeah. And thinking about what you're talking about with health span, right? Like how do you live your longest, best life? It's exciting to think about. So if you have testing done or whatever it might be, like we're looking at a lot of things at CLC right now in terms of, how do we create an environment where people can live their longest, best lives? And we support people that are across the income spectrum. So it's a lot easier to find solutions for people who have money, right? Like private pay, coaching, nutritional coaching, and things like that. But you start using artificial intelligence and put information in there, and you could have a coach, a virtual coach that can help you, right? So it makes me think a lot about accessibility for people.
Affordability.
Yeah. Yeah. Do you see that, Matt? Is that in your thought process?
I think cost is still a major barrier, right? And I love that you guys are able to help people, across the income spectrum. Let's be real, a lot of people that can only live in senior living are doing pretty well for themselves, right? So, I do think as we look, technology is not going anywhere, and we're starting to see like healthcare providers and even Medicare Advantage plans subsidize some devices like tablets, remote monitoring tools, and internet access because, staying connected often improves health outcomes. I've even seen situations of them trying to hire people to help coach them up of how to use the web platform to get their test results and stuff, just because that helps with everybody. I think as we look as adoption grows, what typically happens is, many technologies become more affordable over time. But I do think it's still one of those cost barriers for people. That's something we need to be mindful of, especially as we're embracing technology as we continue to. So.
Absolutely. In that AARP study, they found that, right? That I think it was 2 out of every 5 older adults has to delay buying or upgrading their technology due to that. So yeah, we try to think about that a lot is how do we bring this to everyone? So, so Matt, if you have, so people who are out there listening, if it's an older person, their family member, what would you want them to take away from this conversation?
Yeah, so I think sometimes technology can seem very scary. People are afraid they're going to mess something up. I would say don't let fear really keep you from exploring technology. You don't have to master everything. Just need to find the tools that genuinely improve your life. And I always like to use it as kind of the analogy of going to the gym, right? Like for as much as I wish if I could go to the gym one time and get a 6-pack, that'd be awesome. But that's just not going to happen. You got to keep showing up. You got to keep learning, keep failing, and like getting technology to work for you. Again, it's a tool. Each person might use technology a little bit better, but if it can make your quality of life better, making sure that that is front and center, because I think technology too works best when it stays human first. The goal isn't really about replacing relationships or care. It's about strengthening independence, dignity, and connection.
I love that. That's great.
Too.
Yeah. Human first all the way.
Definitely.
Yeah.
And if technology can help us be better humans too, right? Right. And use our time more wisely with each other. Matt, thank you so much for being with us today. We appreciate you and all that you're doing in our field. You make a huge impact every day with what you do, and you're so visible and out there. And so we are glad that you are part of our world. And we appreciate our listeners and our viewers joining us today for Aging Unscripted. A reminder that aging is indeed unscripted. Please subscribe on your favorite channel and share with your friends and family. Every one of us has a journey that is as individual as we are. Not everyone receives the gift of aging. It is a sacred phase of life that should be honored and celebrated. Thank you all for joining us today. And thank you, Matt.
Bye, Matt. Thank you.
Thank you.